Attention citizens of Jenkinsville. A recent threat to municipal security has brought the CDC to organize a team of specialists with the goal of researching a potential bioterrorist attack. This video comes to you from a private meeting with the leaders of your city and the team of specialists in order to provide the public with more information on this threat.
Thank you all for coming today. We have gathered the leaders of Jenkinsville to discuss a very important issue.
As you all know, our government has received threats lately of a potential virus attack using the Zika virus.
In light of these threats, we want to provide you with the best information we can to help combat these attacks.
Our team composed of the disease detective, the doctor, the lab specialist, and the strategy specialist. It's ready to present you with our findings about the potential catastrophic attack. Let's begin our presentation. Unfortunately, the process of the investigation lost our disease detective. Her passing, however, is unrelated to the disease we're about to discuss.
My name is Grace Miller, and I'm the lab specialist on this team. I will also be presenting the findings of the disease detective. Zika virus is most commonly transmitted through mosquito bites of the species Aedes. A mother who is infected with the Zika virus near the time of her baby's birth can sometimes lead to the baby being born with an abnormally small head, which may affect their cognitive function or damage their eye vision and hearing. The symptoms of Zika are fever, rash, joint pain, and pink eye. These symptoms will usually last from a few days to a week.
I'm Catherine, and I'm the doctor. We still have not found a cure or vaccine for this virus yet, though there are treatments that can help. The Zika virus disease is usually mild and doesn't require medical attention. Treatments mainly focus on relieving symptoms, which includes rest, rehydration, and medications for fever and pain. If symptoms worsen, the person should seek medical attention. To prevent getting the Zika virus, use insect repellent and wear clothes that cover as much skin as possible, and stay in places with air conditioning. People with Zika virus usually aren't sick enough to go to a hospital and rarely die of Zika.
As lab specialist, these were my findings about the Zika virus. Since the Zika virus induces symptoms similar to that of dengue fever and chikungunya, the doctor will ask you about your recent travels to find out if you've been somewhere where the virus is present. Blood will be drawn in order to test for Zika. Infected individuals should only have symptoms lasting for a few days to a week. Symptoms should be treated as needed. It is advised that if you need to take any medication to aid in your symptoms, take acetaminophen, but do not take aspirin or any non-steroidal painkillers. Additionally, be sure to inform your doctor of any medication you are taking for other medical conditions. Lastly, within the first week of your infection, take caution to avoid mosquito bites. If you're bitten, the mosquito would become a carrier and could potentially spread the virus.
I'm Hector. Our first step is to notify the public about the virus attack. It is recommended that pregnant women should be tested for Zika if they have the symptoms. Tell whether you or other people have been infected with the virus attack. If you have been infected, you should seek medical attention within the camps around the city. For every household, everyone will be given insect repellent, screens to put on windows and doors, and mosquito nets for every person on the unit. The government will control the mosquito population by using pesticide and kill both mosquito larvae and adult mosquitoes. Try to stay indoors, and lastly, avoid traveling out of the country if you're going to infected areas.
We hope this information has been helpful.
In conclusion, I would like to remind you about a few things.
1. Zika spreads through mosquitoes. 2. It is especially dangerous to pregnant women. 3. It is important to remember that it is not fatal.
Thank you all for your time.
For more information, visit any of the sites on the handout you should have received.